Osteoid osteomas are benign bone tumours, and they are actually quite common, accounting for around 10% of all benign bone tumours. They are similar to osteoblastomas, but one of the key differences is that they are smaller, less than 2 centimetres across. They arise most frequently between the ages of 10 and 30 and are more common in males than females, in a ratio of 2 to 1. The sites affected are mainly the tibia and femur, where they affect the cortex of the bones, but they can also arise in the hands, feet and spine. One of the characteristic features of osteoid osteomas is severe nocturnal pain that is relieved by aspirin. Grossly, osteoid osteomas are round or ovoid lesions and well circumscribed. Histologically, they have a vascular centre or nidus with anastomosing interconnecting trabeculae of woven bone surrounded by osteoblasts, and around the nidus is often a thick rim of sclerotic dense bone. This is the radiological appearance of an osteoid osteoma of the lower femur. There is a somewhat radiolucent centre surrounded by a rim of sclerotic bone. Osteoid osteomas may resolve without treatment, but the pain can be quite unpleasant, so this can be relieved with aspirin and other non-steroidal anti-inflammatory drugs. More definitive treatment includes surgical excision or curettage, but more recently radiofrequency ablation has been used to treat osteoid osteomas. This is the typical histological appearance of an osteoid osteoma. So here you can see the centre of the osteoid osteoma composed of a rather vascular nidus containing interconnecting anastomosing trabeculae of woven bone surrounded by osteoblasts. And as we move to the periphery of the lesion, into view comes a rim of dense sclerotic lamellar bone.